Oh, I was gonna say good morning, but I know it's afternoon. How y'all doing? Is it nap time for anybody else besides me? Oh, we're gonna, give another round of applause to our panelists really quick before we get started. Alrighty, so our first question is, what are some resources available in schools and counties to the young adults who may be still struggling with the mental and behavioral impacts of the COVID-19 pandemic?
I don't mind starting off.
Go ahead.
Okay. Well, some of the resources that we have at the school, we have a wealth of resources. We have mentoring services for our students that help with connecting to a mentor. We also have in-school therapists that we partner with, different mental health agencies that come into the school and see our students that we make referrals for needing mental health services. So there's pretty much a wealth. And we also have our team of student services that includes the school psychologist, the school social worker, school counselors, as part of it, and the mental health team as well. So there's a wealth of services that are in the school that we can still service students that are still struggling with mental health issues following the pandemic.
Okay.
Can I piggyback on that a little bit? Okay. So also with the school district, the state gives us dollars, and this is true of all school districts in the state. Coming out of the Marjorie Stoneman Douglas High School shooting in 2018, we got a lot of money from the state to provide services to students who have barriers to accessing those services. We know there are a lot of folks out there that don't have the financial resources to access therapy. Even those who have insurance can have high copays or maybe have difficulty accessing a provider that accepts their insurance. Medicaid has good mental health benefits, but again, there's even a scarcity of providers. So we have funds to make those services available, whether it be therapy, case management, psychiatry. All of those are available to our families who need it, and we provide it through a variety of venues, either through our on-site therapists or in community agencies, outpatient office visits, or even at home or via telehealth. So all of those are available through a variety of means.
Okay, and I want to feel like I have a two-part question. Are these resources available to the students? Is it knowledgeable, or what schools are they?
Oh, absolutely, yeah, absolutely. We have the student services team, and every year we do what we call an Act Now presentation to students, letting them know of the various resources that are in school. And we also do trainings our student services does trainings to the faculty, and letting them know what's available, what resources are available here, not just at the school, but outside in the community as well. So we try to do as much mental health awareness as possible, so the students know that if they need to reach out, to someone on site, that there's services that are available that they can reach out. So, yeah.
If I can also add on to that. So another resource that's available that is not widely known is 988. It has been around for a few years, but only 23% of our country knows that it exists. So as was mentioned, we teach, Florida is leading the nation in requiring teachers, 80% of the school systems, to have youth mental health first aid training. So other states are not doing that right now. And in that training, we teach the teachers how to access resources within the schools. And then the other thing that we have is teen mental health first aid, which we know that the youth are more likely to go to their friends before they go to an adult, but we're teaching them the resources to access like 988, and then you also have the Trevor Project for the LGBT community, so that's 678. So we're doing that, and then the awareness of the training that we're doing at Armstrong. And then also, there's like another event like this Friday, the Stop the Stigma event at the Emily Arena, which we're doing more awareness because we know that just saying it once is not enough. We have to keep iterating the resources that are available.
Yes.
And actually, out of the pandemic, I started a nonprofit. After working over 25 years in social work, education, and juvenile justice, I realized there's a huge gap in services, that young people were getting locked up or going to a residential program, and then they would have a little bit of sobriety, but then go back to the traditional school, mostly a public school, and they would fall right back into the same cycle of addictions and, struggling with their mental health. And so I started a nonprofit in 2020, Florida Recovery Schools of Tampa Bay, and I've opened now 3 schools, sober schools. Shout out to my students that are here. Victory High Schools. And so I just want to share with you real quick, our primary purpose is to keep our students alive, number 1. Number 2 is to provide mental health services to them, and then maybe we'll educate them. We are a nonprofit private school, so we have that ability to be more flexible and come to great events like this. But I also wanted to share that the young people that you see here today have survived over 27 overdoses and 15 suicide attempts. So they are walking miracles. Each one of my students. They are walking miracles, and they're here, and they're discovering their voice. And I just thank each one of you for just pouring into them and loving them back to life like we do every day at Victory.
Thank you. I feel like that was very much an input of knowledge that a lot of us needed to know. All right, we're going to move on to question 2. What do you think are the most significant factors impacting youth mental wellness? Go ahead.
So stigma right now is one of the biggest factors. Feeling as though people are going to judge you, or feeling that you're weak. And then also in Black and Latin communities, Asian communities, having mental illness has always been a sign of weakness by the family. So it's not widely accepted in certain cultures. And in Black communities, we talk with, whatever happens in the house stays in the house. Mm-hmm. So we have to continue to have these conversations, not only in the schools, but out in the community, not just with the students, but with the parents and the families.
Yes, because it's a lot of, I'm going to piggyback off that, it's a lot of judgmental people out here that feel that they're better than some youth. Far-wise, they're not having the cool shoes, the cool clothes. So it's a lot of that picks up around the mental wellness and just the scenario itself.
I think it's also really important as school personnel to meet that student where they're at. Mm-hmm. And it's not just about testing. Right. It's not just about the academics. These are young people that we want to thrive. We not only want them to survive, but we want them to thrive and we want them to soar. And we really do that at Victory High Schools, and we just really believe in taking, students as victims and turning them into victors.
A couple of weeks ago, we had 111 threats to the schools. And whether it was fake or real threats, it causes the same trauma. Mm-hmm. And that is a significant threat that is causing a lot of mental health issues throughout the state of Florida. And then also, sometimes what's happening in a lot of districts is that it goes right back to normal. So it's really hard for a student to think about taking the algebra test when they just went through the trauma of having to be in a closet, locked in there, worrying about a threat. So this is an opportunity for us to also spread more awareness about resources that are available in the area during those times.
Okay. One of the themes, too, that I think has really stuck out to me today is the need for us to really listen to our students. We offer a lot of programs. We try to push a lot of information out there, but I think it's really important for us to continue to work toward finding ways of hearing what their concerns are. I mean, we do have some ways that we try to do that. We have a mental health student advisory council that our emotional wellness team recruits from high schools, students who are willing to serve on that committee and kind of represent their schools in discussing issues of importance around mental health, and then to take some of those initiatives back to their schools in terms of programs and activities that they think will be meaningful to their peers. But I also think there's still, as our young man gave in the last talk that I went to, said there's still a disconnect where maybe someone has reached out to a counselor one time and hasn't received a response, and maybe is hesitant to try to do that again. And yet, you never know what was behind that, what went on. But we just need to work harder and continue to try to hear our students and what they really need.
I think also incorporating individual mental health counseling, group therapy, and support groups, that's part of our whole school curriculum, is our students are receiving individual therapy, group therapy, support groups weekly. And that's the component I think that is missing in a lot of these young people's lives.
Definitely.
I was going to mention also too, just piggybacking off the stigma, mental health is still associated with, the stigma of it. When you hear of someone who's maybe dealing with anxiety or depression, we still have that negative, thought regarding it. So I think just, recognizing that it is real, that depression is real, anxiety is real, and what students are experiencing is real. So just, in terms of the community as well, recognizing and knowing that these are real life, situations that the students are dealing with, feelings and thoughts that they're having. So just being awareness, being aware.
And I would like to touch on when the last talk where she said we was in a group about the guidance counselor. I feel that they hold the guidance counselor to a higher standard to be able to understand youth, that what they've been through and the putting themselves in their shoes. Like, I feel like the guidance counselor probably have not experienced homelessness, probably not have experienced mental health, abusive, not even physically, just emotionally with words and stuff like that. So having to talk with the guidance counselor sometimes don't always work. So that's why they don't sometimes get back with the student, or they feel the need, they just needed to vent to me.
Can I add to that? So in the mental health industry, we have a new kind of position. It's called a peer. A peer is a person with lived experience. I'm a person who is a certified peer. I survived suicide from 15 years ago myself. I am a veteran who suffers with anxiety and depression. So deploying peers in schools is something that is a framework that has helped reduce suicide rates in other cities. I was on a conference call where some cities have reduced their suicide rates by 20% in 1 year because of the awareness, the reducing the stigma, ending the stigma campaigns, and deploying peers within the school systems.
Definitely. Okay, the next question is, how can companies support young people who may be struggling with mental health challenges, stress, or personal issues?
Well, I'm not a company, but I did start a nonprofit, and I run a nonprofit, and I have employees. So I think first and foremost, realizing that people have lives outside of the workplace. Also looking at that they are human beings, not human doings. And we have to meet people where they're at. And if they're struggling at that moment, take time off. That's one thing that I always do with my staff is I check in with them, not just on a professional level, but as a personal, on a personal level as well. And just encourage them if they need to take some time off, for self-care, please do that. especially if you work in the helping field, because you're constantly trying to pour into other people, and you have to fill your cup up before you can fill up others.
Yeah, and I was just going to say also, I think with companies that, for them being aware and doing trainings, as we offer to the school, as our school faculty, they can also, companies could also take the youth mental health first aid, where they can educate themselves and understand that way they'll have the knowledge and know how to, work with an employee that may be going through some, suffering with anxiety or depression or whatever type of mental health. They equip them their own self, and that way they can be able to show empathy and understanding for, what their employees might be going through.
I think
agree with
also
that.
too, just being aware of some of the community resources that you might have occasion to mention to an employee that is struggling. So he had mentioned the 988 number, and there are several like that. That's a really easy one just to kind of latch onto, easy to remember 3 numbers. We also, our local crisis center of Tampa Bay utilizes the 211 number. That will get you to them. Actually, so will the 988, I think, if you're calling from this area. And also resources so we have Hillsborough Assist, which is a SharePoint site for Hillsborough County students to be able to access. And I'll just mention that because that's not so much for employers, but good for families who even have students in the district to be able to access that SharePoint site. Also, I wanted to mention Success for Kids and Families. I know there's at least one person here from there. They have the Healthy Transitions program, which is specifically for young adults. Yay! They are an awesome organization that fills a lot of mental health needs in our community, and we just so appreciate them as a partner of the district. But that Healthy Transition programs is particularly for this age group that we're talking about at this conference, and can provide therapy and case management and other services for those who are struggling in that age group. So good for employers to know those kinds of things.
As far as other things that companies can do, what was mentioned earlier is that mental health first aid training can be adopted as a part of orientation for employers in the area. I work with St. Petersburg College. They received a grant with Community Foundation Tampa Bay to train 5 counties, organizations, community organizations, to be certified in mental health first aid, but also to integrate a culture of mental health within their within their organizations is key. We've got to be able to integrate mental health within the corporation so that they can help with the families as well. And then also we need the corporations to partner with community organizations, because we need more mentors, we need more community programs. There's more things that we need to do that all of the community organizations in town are almost like strapped. Everybody's overrun. As mentioned, we have a deficit of psychologists and psychiatrists in the state of Florida, I think 1,000 within the state of Florida. So there's not enough people to be able to, mental health professionals to be able to help. So we've got to be able to come together as a community to provide mentoring, the support groups and everything in order to tackle this problem.
One of the things that we also do at Victory High Schools is we do like lunch and learns, where we invite people from the community, business owners, corporate companies to come in and hear the stories of our students, their experience, strength, and hope, because I think that's important to be able to put a face to that experience, but also that there's hope. Mm-hmm. And that's one of the things that I share with my staff, is that we're just planting seeds of hope. And what happens after that is out of our control, and we just have to have faith and hope that that person's going to flourish.
Yes. I like all the answers, and I want to touch base with the Success for Kids and Family. Great resources. I actually, touched base with it myself, and kind of still in that scenario of having a peer specialist and having someone that's been through what I've experienced and opening up to them. So that's definitely something that the community, I feel that we should embrace more, have more mentors, have more peer specialists to be able to open up for the youth themselves, to be able to open up and experience what they're experiencing, what they're going through. We have one last question, and so have you seen an increase in substance abuse among younger job seekers? How has substance abuse impact your ability to hire and retain talent to the youth?
So we do see an uptick of substance use because we're seeing an uptick of mental health issues. Reports are showing that the effects of the pandemic are just showing up now within a lot of people. So we're seeing an increase in substance use because a lot of youth are not, what I'm hearing from a lot of teachers is that we need to teach more emotional regulation in the classroom because, face it, in life we're going to go through trauma and problems, but we're stuck in survival mode and we're not teaching our youth how to live and how to be more resilient through the trauma and the issues that come along. So being able to teach more of that, like whether it's mindfulness, meditation, and breathing. I mean, there's a psychiatry report that says that mindfulness is as effective as medication in the treatment of anxiety, but we're not widely using it in anywhere or teaching it anywhere. And I think that those are tools that could be more effective. And if we start doing that, we're going to see more of a change.
And it's free. If you just breathe, right?
It's free.
And exactly. But we're not taught, like how to breathe. It's not just like that. And it's simple things like that are coping skills that can give. And we need to teach more. So we talk about the awareness. We talk about the problem. But we need to teach more protective factors.
The solution.
Yes.
Alrighty. Well, that's it for us. Give our panelists a round of applause again. Thank you. Take over.